Hi, Miss Flooney, how are you?
Hi, I'm good. How are you?
I'm good. I'm Koby. I'll be your physical therapist today. What we're going to do today is go over some questions. I'm going to get some information from you, write some stuff down, and then we'll do a physical exam. Overall, it should take about an hour. Do you have any questions? No? Okay. So, Miss Flooney, how old are you?
I'm 56.
56? Okay, and what do you do for a living?
I'm a security contractor.
Okay. What kind of things does that entail you to do?
So I'm working 5 days a week. They're kind of long days, like 6 to 9 hours a day. And
Okay.
I'm really just sitting at my computer desk,
Okay.
typing away.
Typing away. So you're there pretty much all day, huh?
Mm-hmm.
Okay. So do you have any, or do you do any exercise or hobbies? Have any hobbies?
Not really exercise. I mean, I like to go play pool with my buds, but I haven't really been able to because of my pain, and I'm not able to go fly our remote control airplanes with my grandkids.
Okay.
So that's no fun.
So what is preventing you from doing that?
Both of those things have like a lot of like looking up motions that I have a
Okay.
hard time with.
So that looking up
The
kind of.
looking up is what's bothering me.
Okay. What brings you in today? Or so how would you describe your pain?
I would describe it as like a constant dull ache, and it's like right here in the back of my head.
Okay.
It's like back here.
Okay. All right. Do you have any pain anywhere else?
Well, sometimes I have like a different kind of pain. I don't know if they're related, but it's like further down.
So like right here?
Yeah.
Okay. So how would you describe that pain? Or are they the same type, just different?
I feel like the second one is more like a soreness that kind of comes and goes.
Okay. All right. So let me go back to the one that was kind of closer to your head and in your neck there.
Mm-hmm.
As of right now, how would you describe that pain?
It's still kind of daunting.
Still achy? Okay. And then on a scale out of 0 to 10, 0 being no pain at all, 10
Mm-hmm.
being take me to the emergency room, what number would you give? Would you rate?
2 out of 10.
What about when it's at its best?
Also 2.
2, so
This
it's
is-
pretty good right now?
Yeah.
Okay.
It's best.
And then what about worst?
Worst is a 6.
6 out of 10? Okay. So that one gets up there a little bit.
Yeah,
Quite a
little
bit
higher.
more than your best, huh?
Mhm.
Okay. And then you said that other one kind of lower in your mid back there, that was intermittent, kind of comes and goes,
Yeah.
more of a sore feeling.
Mm-hmm.
Okay. So that same question on that scale of 0 to 10, currently, how would you rate that pain?
A 1.
1. Okay. What about when it's at its best?
Also 1.
1.
So it's always kind of there. Just
Yeah.
a little bit.
Okay. And then what about when it's at its worst?
4.
4. Okay. Do you ever have any like numbness, tingling? No? Okay, good. So I drew on this little body chart here,
Mm-hmm.
kind of where you were describing where your pain was at. Does that look kind of accurate?
Yeah.
Okay.
Yeah, that looks good.
So do you have any pain like closer to the top of your head?
No.
Okay. What about like in your shoulders, like more on the outside?
No, I'm just kind of in the middle between them.
And then what about like mid and low back?
Mm-mm. That's good.
No pain in your arms?
No.
Okay. You said no numbness, tingling, right? No leg pain, anything like that?
No leg pain.
Okay. No chest pain?
No.
Any stomach pain? Good. All right. So do you think that the two pains you described, the one kind of in your neck, and then the one a little bit lower, are connected?
I think that the pain between my shoulders kind of comes with the neck-ish back of
Okay. So you can have that neck pain without the one in the back, in between your shoulder blades. Okay. And then it's always like that. That neck pain always comes first.
Yes.
Okay. All right. So what kind of activities make your pain worse? Specifically talking about the neck pain right now.
Definitely any looking up motions bother me. And when I'm sitting at my desk for anything longer than 2 hours, really starts to bother me. And also, actually, now that I'm thinking about it, when I am playing pool, when I have to look up at the ball, that also kind of aggravates it.
Okay. All right. What about the pain in between your shoulder blades? Is there anything that makes that worse?
I think when I'm sitting at my workstation for even a longer amount of time, so
Okay.
maybe 4 hours towards the end of the day,
Okay.
mid to end of the day.
So going back to your first pain, the one in your neck, are there any things that make your pain feel better, go away?
I just stretch, kind of do some side to side movements, some stretching.
Okay.
And that kind of helps it a little bit.
How long does it usually take for your pain to go back down?
A few minutes, so maybe
Okay.
4.
Okay. And then the pain in between your shoulder blades, is there anything that makes that pain better?
Sometimes if I just lie down, on my back for a little bit, a little bit longer than the stretching, so maybe 10 minutes.
Okay. So that one takes a little bit longer to go back down. All right. So on the pain in your neck, how would you describe it in the morning?
In the morning, it's kind of stiff.
Stiff, okay. And then
Yeah.
what about throughout the day?
Throughout the day, it gets worse.
Worse. Okay.
Yeah, worse with any movement when I'm at work. Yeah, that makes
Okay.
it worse.
And then what about at night?
It's the stiff and kind of sore at night.
Okay.
Yeah, but I think in the morning and throughout the day, it's worse.
Okay. All right. So I'm going to take a peek at that form you filled out before you came back here. If you just give me a minute or two. Okay, so I see you circled yes for a couple things here. You circled yes for depression. Is that something that you and your doctor are taking care of right now?
I haven't really talked to him about it. I think
No?
it's just I've been feeling down because I can't hang out with my grandkids as much. So,
Okay. So
it's
kind of
just that was just a joy in my life that I'm not able to participate in anymore.
Have you thought about discussing this with your physician?
No, but maybe I should.
Okay, I think that might be a good idea. Let's see. And then I also see that you circled yes for hypertension. Is that something y'all are taking care of?
Yes, we are managing that.
Okay. All right. And then you also circled yes to a trauma. Is that recent? Is that something that just happened?
Well, I was just thinking about it, and I fractured my bone right here.
Yeah.
I don't even know what it's called, but I fractured that 4 years ago. Yeah, so didn't really know if it was relevant, but thought I'd throw it in there.
Okay. All right. But you don't think that's connected?
Nah.
No, that pain kind of healed and went away?
Mm-hmm.
Okay. Have you had any imaging done? So like an X-ray or an MRI done on your neck or
No.
mid-back? No? Okay. And I saw you're taking Lasix for your blood
I
pressure?
am, yes.
Okay.
That is how we are managing it.
Okay. Do you feel like there's anything that might limit your time here in physical therapy? Like anything that might prevent you from learning?
Well, I just feel like I don't really have a ton of time to come to therapy, so
Okay.
I mean, I'll try and come like as often as you want me to, but
Okay.
I lead a busy life.
Yeah, it sounds like it. Yeah, definitely sounds like it. And then, so learn whenever you're being taught things, you had circled that visual and then like actually doing the action.
So
Is
if
that
like
correct? So
you want to demonstrate and have me watch you, and then maybe like I can do it too to make sure I'm doing it right.
okay.
That'd be good.
All right. So how did all this happen? When did it start?
Like 4 months ago, maybe I just felt like the like back of my head and neck pain. I feel like that started just kind of gradually coming on, and I noticed it more and more. But then the pain between my back or between my shoulders, that started coming on maybe like 3 months ago. So
Okay.
not at the same time.
Not at the same time. Okay.
But nothing happened to me that I
So
can
you
remember.
no fall or ran into something or something ran into you? No.
Mm-mm.
Okay. And most of your pain comes whenever you're looking up?
Definitely.
Okay.
I'd say so.
Have you ever had any pain like this before? Any low back pain in general, neck pain, shoulder pain? No?
Mm-mm.
Okay. All right. So, what are your goals for physical therapy?
I'd really like to be able to sit down at work for, the entire duration of the day without any pain. Really want to get back to my pool playing with my buds
Okay.
and being able to hang out with my grandkids and fly those airplanes.
Fly those airplanes. Huh?
Yeah.
Okay. Take a peek at the other form I had you fill out earlier. Okay, just give me a minute or two. I'm going to write down a couple more things here, and then we'll get on to the next portion of our exam, okay?
Sounds good.
Okay. Can I go ahead and have you take your shirt off, and then your shoes also? Okay. Can I have you standing facing that direction?
Yes. Should I move my hair?
No, you're actually. Can you
Will that
flip
be
to the other
helpful?
side?
Yeah.
Next, can I have you walk down this pathway here?
Mhm.
Just walk to the wall and then back. Okay, can I have you do it one more time?
Yes.
Okay. Any pain with that?
No pain.
Good. Okay. So I'm going to take a peek at your shoulders, just make sure nothing's going on there. If you have any pain, let me know. So just go ahead and relax. Any pain with that?
No.
Any pain with that? Okay. Let's check the other side. Any pain with that?
Mm.
Any pain with that?
No.
Perfect. Okay, so I know you said that the biggest thing that was bothering you was looking up for multiple things, so like flying your airplanes and then shoot and pull. So I want you to show me and to kind of describe what it feels like looking up. I just want you to look up at the ceiling. Okay.
Oh yeah, like right back here, I can feel
Okay.
some of the pain coming on a little bit.
Did your pain increase any? Did it increase any?
I'd say it didn't really increase, but I could definitely feel like it could
Okay.
if I held it there for a little bit.
Oh, okay. Okay. I guess I'll have you go back and sit on the mat there.
Okay.
And then can I have you take your shoes off?
Yes.
Okay. Let me lower this for you. There you go. All right, I'm going to take some measurements and just I'll tell you what to do. Okay. All right. Okay. So can I have you bend your head forward like you're bringing your chin to your chest? Perfect. And then, so same thing, but instead of going forward, can I have you bend your head backwards? Just down real quick. Okay, so this one, it's going to be a little weird. I'm going to stand on top of the table to get this measurement.
Oh, okay.
Okay, so
I'll
it's
catch
just
it.
because I'm short.
All right.
Okay. All right. So what I want you to do is turn your head to the left here, like you're trying to look over your shoulder. Okay. And now I'm going to have you do the same thing, but to the opposite side. Perfect. Okay. Let me get off here before I fall. Okay. 2 more measurements we're going to take. So what I want you to do is, let me show you. You're gonna bend your head to the side like you're putting your right ear to your right shoulder, and then after that we'll go to the left, and you're gonna be putting your left ear to your left shoulder. Okay. All right. Go ahead and put your right ear to your right shoulder. Perfect. Okay. Can we do the left side? Did you have any pain with those?
No.
No? Okay, so what I'm going to do next is, can I have you scoot back
Yes.
just a little bit? Okay. I want you to, that same thing where you were putting your ear to your shoulder, you're going to do that same movement, but don't go all the way, just slightly bend it to the side, okay? I'm going to apply a little pressure. Okay. Perfect, right there. You let me know if there's any pain. Any pain with that?
Yeah, a little bit.
A little bit?
Actually, yeah.
Okay. Let's see. Which pain did it increase? Was it this one, the neck pain?
Yes. Yeah.
Uh,
Not so much the between
Shoulder,
the shoulder,
just the
but
neck?
yeah, just the neck.
Okay. And let me do the same thing, but I'm going to go to the opposite side, okay?
Okay.
So I'm going to have you do the same thing, side bend your head to the left there. Perfect. I'm going to apply a little pressure. How does that feel? Same?
The same, yeah.
Okay. So, but just the
Just the neck.
neck
Yeah,
pain?
yeah.
Okay. All right, I'm going to test some of your muscle strength now. Okay. So the first thing I'm going to do, it's going to require me to place my hands on your cheeks. Is that okay? Okay. So I'm going to place my hands on your cheeks. I'm going to apply a little bit of pressure this way.
Mhm.
I want you to resist me, okay?
Okay.
And it's going to be like to a count of 3, and then I'll stop, okay?
Okay.
Ready? Hold, hold, hold. Okay, we'll do the opposite side. Hold, hold, hold. Good. Okay, so next I'm going to be laying on your stomach here.
Okay.
I'm going to raise you up just a bit. Okay, so your left arm, can I have you bend it like at a right angle like that? Perfect. This one I'm going to have you put your arm down like this. It's going to be like you're in a little chicken wing. And I want you to raise your shoulder up a little bit and then pinch backwards right here, okay? Can you hold that position? Okay. Go ahead and resist me. Hold, hold, hold. Okay. Okay. So now this one, can I have you bend your arm up? And we're going to do the same thing on this side. Okay. So you get in that little chicken wing position and then pinch here. Perfect. Okay. Don't let me move your arm. Hold, hold, hold. Good. Okay. So this next one, I'm going to have you straighten your arm. You're going to hold it at about a 45-degree angle there, and then I want you to pinch your shoulder blade together, okay? Can I actually have you scoot to the edge here?
Yeah.
I'll make it a little easier for you.
Thanks.
Okay, so you have it at about a 45, and then pinch your shoulder blade together, okay? I'm going to apply a little pressure, don't let me move your arm. Hold, hold, hold. Okay. Any pain with that?
No.
No? All right, let me do the other side now. Maybe scoot to this side, or this edge. Okay, same thing. 45-degree angle, and then pinch your shoulder blade together. Good. And then resist me. Hold. That one's a tough one, huh?
Yeah.
Okay. So go ahead and just lay down there. And put your face back in the little face hole. I'm just going to feel around in your neck and then your back. You let me know if there's any pain.
Yeah.
Okay. Just go ahead and relax. Any pain with that?
It's a little more tender.
A little more tender?
Yeah.
Okay. A little more
Right.
painful? Any pain with that?
No, nothing.
What about with that?
Not so much, but.
What about in the middle?
Yeah, right in there.
Right there?
Mm-hmm.
So in between the shoulder blades there?
Yeah.
What about if I come out onto the left side?
Not so much out there, but.
More in the center there?
Yeah.
So is it, what kind of pain is it? Is it like a stiff feeling?
Yeah.
Yeah.
It's like stiff.
Stiff,
Kind of
okay.
the soreness.
The soreness, okay.
Yeah.
Did it increase your pain any?
No.
No? Okay. I'm gonna do a little movement on some of the vertebrae, or test some of the movement on some of the vertebrae in your back there.
Okay.
Okay. Just go ahead and relax. Same thing, just keep your head down there. Any pain with that?
Maybe a little bit, but not really pain. Super pain.
It's just kind of that soreness. Is that decreasing as I move further down here?
Yeah.
Okay. I'm going to do one more little thing here. This time I'm going to check the movement in your neck. Is that okay?
Yeah.
Go ahead and relax. Any pain with that?
A little tender.
A little tender?
Yeah, a little painful.
Okay. You can go ahead and sit up. Here, you can actually put your shirt back on.
I'm gonna fall asleep.
There you go.
Thanks.
So how did that feel?
Sometimes it's a little painful, but overall, I think it felt good.
Helped out a little bit?
Yeah.
Okay, good. So I think what's going on here is you might have just a little bit of, or the bones in your neck and kind of into your middle back there are just having some issues moving. And I think that's what's causing your pain, making it a little difficult to look up. So that's definitely something we can work on. We can get those moving again, to where you're able to look up and get back to doing your flying the airplanes with your grandkids and playing pool with your buddies.
I'd love that. That sounds great.
Okay. Well, do you have any questions for me?
How often do you think I'm gonna have to come per week?
So I know you said you're really busy. Do you think maybe twice a week
I think I can
For-
swing that.
for maybe 6 weeks? Does that
Yeah.
sound okay?
Yeah, sounds doable.
All right. Well, let me walk you up to the front desk and we'll get you set up.
All
Okay.
right, sounds
All right.
good.
Thank you. It was nice meeting you.
Thank you. You too.